Good day, this is Dr. Corper, and I wanted to share a few comments concerning the lethal injection of Charles Warner. Charles Warner was convicted of raping an 11-month child and killing her. Her name was Adriana Walker. And last year, he was given lethal injection. And during the autopsy, they brought the medications that they had used, or the unused medications, and they noticed that there was a drug error at that time. Instead of using potassium chloride, they used potassium acetate. So during a lethal injection, 3 medications are used. The first drug is an anesthetic or a sedative to be able to put the patient to sleep, sedate them. In the past, sodium pentothal was used, which was very effective. In this case, midazolam, or a drug called Versed, is the trade name, was used to sedate the prisoner. Then when the patient is sedated or asleep with this medication, a drug called pancuronium is given. This medication is used during anesthesia to paralyze the patient for surgery so the muscles are loose and makes it easier for the surgeons to operate. Also, we use these medications to facilitate the placement of a breathing tube inside someone's mouth. When they're relaxed by this medication, it makes that a lot easier. The second medication does not put you to sleep. It just paralyzes you and makes you very weak. The third medication is potassium. Potassium is given to stop the heart. Pancuronium, the second drug, is used so the patient is not moving during this process, which can be quite disturbing for the onlookers. So in this case, potassium chloride was not used, and that is the prescribed medication for lethal injection in this case, and potassium acetate was used. There have been reports that potassium acetate is used for mummification, and that is correct, but it is also used for diabetic ketoacidosis. So it is the medication that physicians can use to replace potassium in certain critical situations. So there was a mistake apparently in this situation, and yet potassium was used in both cases, and just the ion that was used instead of chloride acetate was used, which does not really change really the purpose of the potassium nor its effectiveness as far as I'm concerned, or have any knowledge of. So I wanted just to share those remarks concerning this lethal injection. I think in the press there's a lot of excitement about this dramatic mistake that was made, but it looks like potassium was just substituted. One form of potassium was just substituted for another, which should not cause much difference in the effectiveness of the way the potassium is used. I am not, at this time, don't have time to get into the debate concerning lethal injection or capital punishment. Obviously, both sides are using these topics to further their arguments. Specifically, the people who are opposed to lethal injection, opposed to capital punishment, are using all kinds of these experiences to try to rule out the use of lethal injection. For the most part, lethal injections in giving an anesthetic like sodium pentothal is using the same types of medications that we use millions of times in the United States to put people to sleep for surgery. We definitely would not feel like this is cruel and unusual punishment. So I appreciate the opportunity I've had to share these comments with you. This is Dr. Corper signing off.